Now for hemophilia. This is an inherited bleeding disorder in which the blood does not clot normally, increasing the risk of excessive bleeding after any type of small injury, say from a paper cut or even a fall on the ground. So hemophilia A, we lack the clotting factor 8, which helps the blood to clot. And in hemophilia B, we lack the clotting factor 9. So Hesse mentions, a nurse is caring for a patient diagnosed with hemophilia A. The nurse knows which type of hemophilia is caused by an absence of which clotting factor. 8. Now, as far as signs and symptoms, we just have excessive bleeding, as you know. So we see pain, bruising, and petechiae, the little red bumps under the skin, and ineffective tissue perfusion, as well as joint stiffness and even lack of mobility. So Hesse mentions, a nurse is caring for a patient with hemophilia. Which concerns would be expected on the nursing care plan? Select all that apply. Pain, anxiety, deficit of fluid volume, and ineffective tissue perfusion. Yes, think about the low clotting factors here for hemophilia. Now for treatments, we avoid anything that can cause bleeding. So we always avoid any injections like IV, IM, or even sub-Q. Just think needles will cause more bleeding. And we administer coagulation replacement factors. Now, if an extremity was injured, then we use ice packs and we elevate the affected area. So Kaplan mentions, a client with hemophilia develops painful swelling of the knee after bumping the leg. Which initial action is most appropriate for the nurse to take? Apply ice to the knee and elevate the leg. And a second question, the nurse is reviewing the medical records for a client diagnosed with hemophilia. It is most important for the nurse to question which injury. Meperidine 75 milligrams IM. The key term here is IM. Remember, no injections here. Now in terms of education, like all bleeding disorders, we want to have no NSAIDs, which can increase bleeding, no razors, and no contact sports. So Hesse mentions, which statement by the patient with hemophilia indicates the need for further teaching? I can play contact sports for exercise. No contact sports. Now, as far as bleeding teaching, let's play a segment from our pharmacology master course. For patient teaching, the big contraindication here, and to be honest, for any blood thinner, is key term active bleed, like a peptic ulcer or peptic ulcer disease. And we always avoid any patients with liver problems since the liver makes coagulation factors. So we use the acronym CHANT. C for cirrhosis, H for hepatitis, A for alcohol. Key term on the Hesse was a client just drank 6 beers. N for NSAIDs, and the ATI loves to name naproxen and ibuprofen. And T for Tylenol overdose, leading to liver damage. Now we monitor signs of bleeding and we notify the HCP ASAP. Keywords used on ATI was black tarry stools, usually indicating a GI bleed, hematuria, or blood-tinged urine, epistaxis, or nosebleed, and even petechiae on the chest, mentioned by Hesse, and easy bruising. Now, supplements to avoid completely. No Eggos, guys, like that old waffle commercial. Lego my Eggos. E for vitamin E, G for ginseng, ginkgo biloba, and garlic, and O for omega-3s, and the S is for St. John's wort. Lastly, we avoid trauma, so the big key terms used on the Hesse. No small rugs or dim halls. Always well-lit hallways. No brushing hard, we use a soft bristled toothbrush. No flossing. No alcohol-based mouthwashes. No razors, only electric shavers. No constipation, only fiber and fluids, guys. And no contact sports. And we always wear a medical alert bracelet.